Hello, and welcome to today's webinar. Really excited to talk about optimizing the patient experience journey and how it can help you achieve higher retention and acquisition rates. So let's get started. My name is Pauline Ith, and I'll be hosting today's webinar. I'm an account manager here at GMR Web Team, where we help practices around the US acquire and retain more patients by strengthening the 3 pillars of healthcare marketing success. So this includes building a stellar online reputation, maintaining a high level of patient satisfaction, and creating a strong online presence. So for today's webinar, I want to go over how healthcare consumerism is really changing the way patients view and approach healthcare services and how they find providers. And we'll also talk about how it's also impacted the patient experience journey and how that in turn impacts your practice growth. And of course, we'll talk about the 5 ways to improve the patient experience journey, and then we'll finish off with a Q&A session at the end. So please leave all your questions in the Q&A box and I will answer. And if you miss any part of the webinar, don't worry, we'll send a recording of the presentation within 1 business day after it's been completed. So let's get started. So let's talk about healthcare consumerism. So why does it matter in this day and age? So it's because healthcare is now seen just like any other product. The prospective patient is now assigned the role of a buyer or presented with a plethora of options. And the choice is now with the patients to make their decision based on cost effectiveness and other incentives. Traditionally, people will choose a provider that's nearest to them, but that's no longer the case. Cities have grown in density, and same with suburban areas. Powered by choice, patients are definitely becoming a lot more picky. And they're also doing more research than ever. So you can see here from Becker's Healthcare, they found that 72% of consumers are using the internet to find healthcare information. So this could be a qualified provider, but they could also be using the internet to learn about possible diagnoses and treatment options. So let's talk about what exactly is contributing to the rise of healthcare consumerism. I briefly touched upon this already, but technology and internet access has definitely been opening doors for patients. We are no longer limited to what is just local to us. The internet gives us endless information, and patients are using it to choose their provider carefully. So another thing, patients are also footing the bill for a considerable amount of medical services. So people are on higher deductible plans, financial responsibility has gone up. So for example, if you can think of a patient who's paying out of pocket, that patient will definitely be more picky about who they're giving their money to, right? In combination with a higher financial responsibility and with internet access, this results in higher expectations from the patient experience. So all other industries are definitely, changing the game when it comes to the customer service and prioritizing that. So patients are thinking, why can't that be the same for healthcare? Not only do they want excellent care, but they want to be treated like a priority and not just another number at the clinic. They want a high level of patient experience, whether that be, before making an appointment, during their appointment, and with any follow-up visits. So now that we know patients expect more from their experience, we need to optimize the patient experience journey, right, for the modern patient. And that's how you can position your practice for success. So first, I wanted to define what the patient experience journey means. It just means any touch point between you and your prospective patient. And, I want you to think of every possible touch point. So try to think beyond your office walls. Think about how will patients encounter you before they even choose you as a provider and decide to make an appointment. Think about that. So give a second. I just want you to think anywhere from traditional touch points you might think to beyond the office walls, where that is. So let's go over some touch points. I think most providers will think of the traditional ones, which are, in-person focused. So this could be interactions with your staff. Provider bedside manner is one of the first things you'll probably think about. It also includes, how treatment options are explained, and things like information on billing and insurance. So these are traditional touch points, but you also want to factor in touch points through digital channels. So searching online for the ideal provider. So since we know patients are using the internet to find a provider, it's actually one of the first touch points. And so is your website. This is where patients will learn more about your practice and all the providers and all the services you provide, and even things like insurance. Another touch point that people don't think of is online reviews. Patients really do want to know about other experiences patients have had with your practice before they even book an appointment. So this is one of the ways they'll interact with your practice through digital channels. And of course, there's so many touch points beyond this, but the ones I mentioned, we consider the major ones that affect the modern day patient experience and directly impact how you can grow. So again, patient experience is on the forefront of every patient's mind, even though it's not the exact term they're using. Patients want to feel like a priority. I'll keep mentioning that throughout this presentation, but it's really true. They don't want to be another person pushed throughout the door. And we can see that 96% of healthcare consumers perceive patient experience as important in their provider selection process. So think of all the touch points, like we already mentioned, before the door. They come through your door, and that's part of it, right? And then on the other hand, we can see 51% of patients would find someone else if they think they'll receive better service. Again, consumerism is thinking patients, has patients thinking of healthcare as a service, just like any other business. So, poor experience will drive the most patients away. If they have a negative experience multiple times or even start to finish, this will result in lower retention rates for you. New patients will have trouble, sticking with you after their first visit, and existing loyal patients may leave to find someone else if they're very unhappy. Again, patients now have more choice, so they're going to tolerate a lot less in order to get the care they need. So we already know, kind of in summary, better patient experiences also result in better patient engagement. They'll be more proactive in getting the care they need, following treatments you recommend. In addition to that, patient experience will also result in more loyal patients who will be ready to stay with your practice in the long run, and also recommend your practice to friends and family, which results in more patients coming through your doors, right? All this just adds up to increased revenue and practice growth in the long term. So that's why we want to optimize the patient journey, right? So let's look at all of that from start to finish. So from pre-appointment all the way to post-appointment. So let's take a look. So first, let's talk about a robust and stellar online presence, right? So this is very key to making a good first impression at, a positive touch point with your prospective patients. Again, this is not a touch point you'd immediately think about as part of the patient experience journey, but the provider selection process is so critical, right? It's involving the internet. So it's one of the first places patients will learn about you and evaluate if they will trust you with their care. So remember, patients are actively using the internet to learn more about their options and what providers are out there. So one of the first things they'll come across is your website. So you want to make sure your website has all the relevant info, your credentials and experience, what services you provide. So if you're a dentist, do you do implants? Do you do pediatric dentistry? Do you do sedation? If you're an OB, do you do high-risk pregnancies? So those are pertinent things that help them, arm them with information to make a good choice, right? And you also want to include things like insurance information. It's surprising how many patients or many practices don't include that, but you want to make sure you do that because factoring if you're in network or not is still one of the key factors that patients consider when they choose a provider. Second thing, online listings. So what this is essentially your Google business, your Yelp, your Facebook page, your health grades page. So these are all listings, right? And these are critical because if you don't have any listings, it's going to be hard for Google to show your practice to prospective patients and for patients just to find information about you in general, right? So these listings have your practice name, phone number, and address. The more accurate it is, the more likely search engines are to recommend you when patients search for something relevant, such as an OB/GYN near me or a family doctor near me. So without these, again, you won't be found, and there's essentially going to be no touch point between you and the patient, right? Third thing is online reviews. So remember, 81% of patients will use online reviews when selecting a healthcare provider. So this means poor reviews will make patients more hesitant to choose your practice, right? So like we already discussed, their time and money is precious. So they're not going to give a business to a poorly reviewed practice. So make sure you're generating reviews on a consistent basis and you're maintaining a positive online reputation. So here's an example of an OBGYN website that we built for one of our clients. Just want to share this with you because it's good to take a look at your website and see what you need to fix. And here we have a desktop and mobile version of the site. And it's really critical that your mobile site is really functional and looks good and it's performed properly. I'm seeing more and more searches are occurring on mobile. And in fact, with this client, 60% of their website visitors are actually coming through mobile devices. So you can only imagine if a prospective patient is struggling to load your website on mobile, can't even navigate it, looks funky, they'll give up and choose someone else. And you can see we also share pertinent info like how many providers at the practice, what are their credentials, services. For example, in this case, if they have childbirthing classes, it allows new patients, to see all the information, see if you're the right fit for them. So that's why it's really key. You want to make sure you have a great website here. So let's say you get them, the patient's, interested and they're ready to make an appointment. So you want to make sure that this is as easy as possible. So first, always have a call option ready on your website and on all your listings. Make it easier for patients to call. And one study done by Kairos on the patient experience, they found that 65% of baby boomers prefer phone calls, while 59% of Gen X prefer phone, and then 44% of millennials prefer phone. So you can see phone is still a great option. You just want to make sure it's available. But since more millennials and Gen X prefer online options, you want to make sure online appointment requests and forms are still available too. What I love about that is that patients can request 24/7, even when the office is closed, people can still make an appointment or request one at least. We also suggest having an online patient intake option. Why? Patients who book their appointment can quickly fill out their paperwork online. So this means patients, will be ready to go and they won't have to do it at the office, right? So especially if you have a long patient intake form, you don't have patients sitting there in the office for a while filling that out. And also this allows, your staff to process everything for a seamless patient experience so they can actually focus what's going on, at the office. And there are a lot of platforms out there that do online patient intake. So just make sure you find something that is HIPAA compliant. That's really key. Another touch point is the reminders for the appointment, right? So patients have made their appointment. We don't want them to forget, right? So I highly recommend setting up appointment confirmation reminders via text because it really does help reduce no-shows. Missed appointments or canceled appointments result in less revenue for your practice, right? I know a lot of practices do phone call reminders, and that's still a great option, but I think now that we're moving towards an age where everything's a lot more digital, people are always on their phones, I think text is another great option, especially if you want more Gen X and millennials to come in. As far as a reminder schedule, you just want to make sure you find something that works with your patient base. I find that older patients tend to not prefer as many notifications that younger patients may like. So it's all about testing out and figuring out, what works on patient feedback. Our general tip, we usually recommend at least 1 week before the appointment and then 3 days before. You may want to adjust this one if you have a reschedule or cancellation policy, just so patients are aware and they can reschedule in a timely manner. And I usually recommend day before or day of. It's very close. So again, different reminder schedules work different for different practices. So just find what works best for you. Okay, so now one of the most critical junctions in the patient experience journey is just the moment the patient arrives in your office. And I think a lot of practices, for the most part, have this down pat because if it was a terrible experience in the office, I don't think most of you would be in business. But it's good to revisit these points, right? Because the experience in office can really make or break your practice. It can even drive away the most loyal patients. For example, you have any staff, they aren't being treated well, loyal patients will move, right? So it's critical. Front desk, make sure you guys greet everyone that walks in and are friendly. Again, first impression, especially for those new patients, they see, a happy office, it's going to make a good impression, right? And then second, you'll want to make sure you explain every part of the check-in process, especially for those new patients and older patients, especially for some of those who haven't visited in a while. Make sure you make it easy for them to check in. Third point, make sure patients, get their help doing their paperwork. Ideally, you want them to do it online before, but if you have to do it in office, make sure you give them, proper guidance and check everything, make sure nothing's missed. Fourth, want to make sure you handle all the phone calls really well. Don't leave people on hold for too long. Have a happy, upbeat tone. I think I usually feel like sometimes this is where practices struggle when they continue to grow and scale and they have new team members. This is where you can kind of lose some patience because phone calls aren't being handled properly. So you don't want to be one of those practices. So make sure you're properly training all the employees and how they handle the phones. Last tip I have for everyone is, it's really critical that you create a process to monitor patient satisfaction. Without measuring patient satisfaction, you won't have data to continuously improve the patient experience. Optimizing the patient journey isn't a one-time thing. It should evolve with the growth of your practice, right? So I want to share our process here at GMR for monitoring patient satisfaction. We use a format called Net Promoter Score, also known as NPS. And NPS surveys are just a one-question survey that asks you on a scale of 0 through 10, how likely are you to recommend the practice or provider to a friend or family member. We send the survey via text or email after the patient has been checked out of the day. And the goal is to, survey same day because that's when you get the most accurate feedback, right? So this not only allows you to capture measurable data, but it's a quick survey that really does produce a high response rate for our clients. Again, the benefit of the survey is that you understand exactly where you've improved, where your strengths are, and then areas of improvement, right? And it's a great thing about the survey, if they rate whether positive or negative, there's a drop-down box where a comment box where they can just fill in other comments, and that's where we can take a look at all the data. With our system, if a patient responds negatively, the practice will get a notification of the rating, and they'll get information about which provider saw that particular patient and what the comment was. So benefit of this is that your office will know, okay, who had a terrible experience, and then you're able to reach out to them and better understand what went wrong, and hopefully you can retain the patient, right? And as your practice grows, sometimes things fall through the cracks, and I think having this kind of process will help you make sure you increase retention rates as you grow further. So, and one of the benefits of our platform is that we're able to view the data in one place, and we have tools to quickly analyze all the patient responses. So you can imagine if you're a multi-location practice, you don't have to worry about sifting through all that data. In addition to our, surveys, we're also able to request review. So it kind of kills two birds with one stone. And again, with all the survey responses you'll be getting, you can really understand what's wrong, whether it's the check-in process, the wait time, provider bedside manner. And by surveying, you aren't guessing, and you know exactly what works and what doesn't. And to implement a survey like this, again, you can use a vendor like us here at GMR, or you can see if your EMR has one. You just want to share whatever platform you use. It's HIPAA compliant, so make sure of that. So I'm wrapping up the presentation here. So let's go over some key takeaways that we discussed today. So first, we talked about healthcare consumerism and how it's changing how patients approach healthcare, and that they demand more from their patient experience, which results in, practices needing to improve in order to grow and thrive in today's modern age, right? And second, we also discussed the patient experience journey and how, there's multiple touch points, with a lot of it beginning online. So you want to make sure you make a good first online impression in order to get patients through your doors, right? Poor online experiences and in-office experiences just result in fewer patients. And of course, creating a compassionate, caring environment is still a critical piece of that patient experience journey. It's definitely where you can build a very loyal patient base and long-term growth. Lastly, just have a proactive approach to collecting feedback, right? So we went over why it's critical and how it really helps you identify, how many patients are happy, what are your retention rates, and we also went over the Net Promoter Score survey process and how we collect feedback for our patients. Perfect. So let's talk about, any questions that you guys may have. So let me see here. Okay. So I have one question here that says, how can we generate more online reviews? So yeah, I didn't touch upon that too much in this presentation, but there's so many different kinds of online reputation management software out there that can help you with this. Again, at GMR, we have one. You can integrate with your EMR and survey patients. But if you don't want to use an online reputation management software, make it easy. Have a QR code in the office where you can link to your Google profile or HealthGrade's profile so patients can scan and leave a review. I do recommend something like an online reputation management platform, though, just because it takes a lot of the work, and especially if you have staff members who are a little shy about asking, it kind of takes that human factor out there, and you can have a whole reputation management platform. And it's great. It automates it, surveys every patient, so it increases the likelihood you'll get more positive reviews. So definitely that's what I recommend. Here's another question. Do I have to do an NPS survey? Would a multi-question survey work? Yeah, so you can definitely do a multi-question survey. I usually don't recommend it, just because if you have anything more than like 5 questions, patients are going to be really lazy to respond. But you can definitely do it. I would say keep it to 5 questions. You can tackle front desk, the provider, and then maybe have like an open, box for any other comments the patient has. I've also seen some practices of ours do an NPS survey, and then once a quarter, they will send out a multi-question survey, because I know a lot of bigger orgs, they care about HCAHPS, and I think multi-question is good to kind of see what your potential HCAHPS score is before they send out the actual survey. So definitely multi-question survey would work. I would just, if you're sending one daily, I would not have it be more than 5 questions. Okay, I think that's all the questions we have for today. Just want to give you guys some more information about us at GMR Web Team. So, if you need help growing your practice, you can definitely schedule a free consultation with us. We can take a look at your current online presence and provide you a recommendation on the solutions, strategies, and technologies we can use to help your practice grow. So you can visit our website at gmrwebteam.com, give us a call, or shoot an email, and we are more than happy to help. But yeah, thank you so much for joining today's webinar. Thank you so much, and I hope you have a great rest of your day.